Good morning, Dr. Mahmoud with you. Today we will do a demo on periapical film. Could you come here, please? This is a film where we take the radiograph of periapical film. There is two surfaces. One of them is smooth and the other is not. There is written here opposite side towards the tube, so that side will not be towards the tube. Okay. There is something like imposed dot that will be on the crown, towards the crown. Okay, so when we take a radiograph for upper, it will be downwards, while if we take it for the lower, it will be upwards. Okay. First of all, we must make the patient position. Okay, so he must sit upright, massage the plane perpendicular on the floor, and the occlusal plane parallel to the floor. Okay. So if we have to take the radiograph, we have anterior film, canine film, premolar film, and molars film. We will hold the film vertical like that in case of the anteriors and the canine. Okay. While on the posterior, the film will be horizontal like that. Okay. And the dot again towards the crown. Okay. So first of all, we will put the film like that, and he will support with his thumb, and the film will be in the center. 2 millimeters will be below the crown. Okay. After that, we will bring the vertical angle, which will be 55 degrees. Between 50 and 60 here, and we will cover the area by the film. Where here the point of entry, which is the middle of the cone, okay, will be pointing on the tip of the nose. Okay, that's for the upper anterior film. The lower anterior, we will put the film. The dot will be upwards, and he will support with his index. Okay, just like that. And 2 millimeters will be above the occlusal surface. Here the cone will be pointed upwards like that. Okay, that's negative degree, by the way. And the angle, we will check it again to be 25 degree. 2 millimeters also above incisal edge. Okay, and here the occlusal plane must again be parallel to the floor. Okay, because we will take upper canine. Upper canine will be in the center of the film like that. He will support again, but here by his opposite hand with his thumb. Okay. Where the film here, the canine is in the middle of the film and 2 millimeters above the occlusal plane. Angle here will be 45 degree. And here the point of entry, which is the horizontal angle, would be on the ala of the nose. Okay. Here we must check that the cone cover the film. Okay. While if we make the lower canine, again, the film will be canine in the center of the film, 2 millimeters above the occlusal plane. Here with the opposite hand, will support 2 millimeters above the occlusal plane. Okay, the angle 15 degree or 20. Okay, and here we will draw like a line with the inferior border of the mandible to intersect each other above the inferior border and in the ala of the nose again. Okay. If we will take the film of premolars, the dot will be for upper premolars. The dot will be downwards where the film will start on halfway of the canine, okay, and he will support with his thumb, while 2 millimeters above the occlusal plane, and the film is parallel to the occlusal plane, like as you see, like that, okay? The angle will be 35 degrees. A line we draw from midway of the canthus with the ala tragus where they intersect, and it will be our point of entry, okay? We must check that the cone covers the film again, okay? And the bottom surface is from this side, so the cone must be directed from its side to be perpendicular on the film, okay? As for the lower, the angle here will be 10 degrees. He will support with his index, 2 millimeters above the occlusal plane, and the cone covers the film, okay? Here again, canthus with the inferior border where they intersect, and the cone cover film, okay? As for the last film, upper and lower molars, the dot again towards the floor, down, towards the crown, okay? Here the film will start halfway of the 5, okay? And he will support with his, he can support with his thumb or index. If he has gag reflex, he can support with his index as the surface area is smaller than the thumb, okay? The angle here is 25 degrees. As for, and positive like that, okay? As for the last film, angle here is 0 to 5, minus 5. The dot is upwards. And we'll start on the 5, okay? Halfway of the 5. 2 millimeters and parallel to the occlusal plane like that, okay? And the cone from the outer canthus, midway on the inferior border of the mandible. Thank you.